to Nursing Prep. Push yourself in nursing preparation with smart way. The today topic is safe and effective care environment. A patient hospitalized with MRSA, methicillin-resistant Staph aureus, is placed on contact precautions. Which statement is true? Option A. Risk for transmission is high, so the patient should wear a mask. Option B. Transmission can be prevented by hand hygiene, gloves, and a gown. Option C. MRSA requires frequent contact, so the door should remain open. Option D. The patient must be placed in a room with negative pressure. Right answer is Option B. Transmission can be prevented by hand hygiene, gloves, and a gown. The CDC recommends a private room for patients requiring contact isolation. Gloves, a gown, and a mask should be used when caring for the client. Proper hand washing before and after patient care is essential. The door should remain closed, but a negative pressure room. MRSA is spread by contact with blood or body fluid or by touching the patient's skin. It can be cultured from the nasal passages, so instruct the patient to cover his nose and mouth when he sneezes or coughs. After a conference with the family, a patient's care provider writes a Do Not Resuscitate (DNR) order. What does the nurse understand when planning care for the patient? Option A. Death will take place within the next 72 hours, so family should prepare. Option B. The patient and family may no longer make medical decisions. Option C. DNR orders from a previous hospitalization will be valid and legal. Option D. Nursing care will continue with the treatment orders in place. Right answer is Option D. Nursing care will continue with the treatment orders in place. A DNR order only controls CPR and similar life-saving treatments. All other care and treatment continue as ordered. Competent patients can still decide about their own care, including rescinding the DNR order. A new DNR order is written with each hospitalization. A pediatric nurse gets a call from the emergency department that 2-year-old is being admitted with a diagnosis of febrile seizures. In preparing for his admission, which of the following is the most important nursing action? Option A. Place a cooling mattress on his bed. Option B. Pad the side rails of his bed. Option C. Order a stat admission CBC. Option D. Place a urine collection bag and specimen cup at the bedside. Right answer is Option B. Pad the side rails of his bed. With a diagnosis of febrile seizures, precautions to prevent injury and promote safety should take precedence. Padding the side rails is appropriate. Laboratory tests and a cooling blanket must be ordered by the physician, and both may have been done in the ED. During a staff meeting, the supervisor reports on a recent infection control audit. Which finding indicates a need for staff training? Option A. A lab technician puts on a mask, gown, and gloves before entering the room of a patient on strict isolation. Option B. A patient with active tuberculosis wears a mask when going to another department for testing. Option C. A nurse with open lesions on her hands puts on gloves before giving direct patient care. Option D. A certified nursing assistant does not wear gloves when feeding an elderly patient. Right answer is Option C. A nurse with open lesions on her hands puts on gloves before giving direct patient care. There is no need to wear gloves when feeding a client. However, universal, standard precautions, treating all blood and body fluids as if they are infectious, should be followed in all situations. A client with active tuberculosis should be on respiratory precautions, including wearing a mask outside his private room. Staff members with exudative lesions or weeping dermatitis should not give direct care or handle patient care equipment until the condition resolves, even if wearing gloves. When a patient refuses treatment, this is an example of Option A. Common law. Option B. statutory law. Option C, medical law. Option D, civil law. Right answer is option A, common law. Common law allows a mentally competent adult to refuse medical treatment, even if it hastens death. Individual cases contribute to the precedents for resolving a legal conflict. The right to refuse treatment is based on U.S. cases from 1891 and 1914. The judgment of the 1914 case, Schlendorf v. Society of New York Hospital, states, every human being of adult years and sound mind has a right to determine what shall be done with his own body. The nurse enters a client's room and finds the client lying on the floor. What should the nurse do first? Option A, determine if the client is responsive. Option B, ask the client what happened. Option C, assist the client to return to bed. Option D, call for help to get the client back in bed. Right answer is option A, determine if the client is responsive. Always assess a patient after a fall or other incident. An unresponsive client may have a head injury from the fall or be in cardiac arrest. The Code of Ethics for Nurses was written and published by the Option A, National League for Nursing. Option B, National Institutes of Health. Option C, American Nurses Association. Option D, American Medical Association. Right answer is option C, American Nurses Association. The ANA Code of Ethics describes the obligations and duties of every nurse. It is the nursing profession's non-negotiable ethical standard. The latest revision was done in 2015. The American Nurses Association was founded in 1898. The National League of Nursing was founded in 1893. When a patient is admitted with acute influenza, what type of isolation is most appropriate? Option A, contact isolation. Option B, strict isolation. Option C, respiratory isolation. Option D, reverse isolation. Right answer is option C, respiratory isolation. Respiratory isolation is used to prevent transmission of organisms by means of droplets that are sneezed or breathed into the environment. Examples of such diseases are influenza and tuberculosis. The patient and nurse should wear a surgical mask during care. Visitors should wear a mask and stay at least 3 feet away from the patient. Which is the priority for a child who has returned to the unit after surgery to repair a cleft palate and lip? Option A, preventing infection. Option B, ambulating every hour. Option C, interacting with others. Option D, managing pain. Right answer is option A, preventing infection. Following any surgery, the first priority is preventing infection. Besides antibiotics ordered by the surgeon, there may be a need for restraints to prevent the child from touching the incision. Pain management is also important, but not the first priority. Ambulation and social interaction are not initial concerns for the nurse. Nurse Practice Acts are an example of Option A, civil law. Option B, statutory law. Option C, criminal law. Option D, common law. Right answer is option B, statutory law. Statutory law comes from authoritative and legislative sources. Nurse Practice Acts are statutory laws regulated by each state in the U.S. The states establish licensing agencies or boards that oversee nursing practice. Thanks for watching. If you like our video, then do like, comment, share. Subscribe our channel for regular updates.